So why do we care about blood sugar spikes at all? And why is it that monitoring them is valuable? First of all, let's define what we mean by blood sugar spike. By defining what we mean by blood sugar. When I talk about blood sugar, I'm talking about blood glucose. Remember that dietary sugar and blood sugar are not the same thing. Dietary sugar is glucose and fructose. Fructose is the sweet molecule in sugar. Fructose is the molecule that's vestigial to all animal life forms on this planet. Fructose is the sweet molecule that makes us crave sugar. Fructose is addictive. Glucose is the energy of life. Glucose is the information and the substrate that your cells can use to actually power itself. Fructose is not. So when we talk about blood sugar spikes, we really are talking about blood glucose spikes. And we're going to use that nomenclature from here on. So what does a blood glucose spike do? Why do we care? And the answer is, when you eat something, the glucose goes into your bloodstream, and then that glucose is available to all of your cells. The question is, does the glucose just enter the cell, or does the glucose need help getting into the cell? And the answer to that has to do with what kind of cell it is. Adipose tissue, the glucose doesn't go in unless there's an insulin molecule to usher it in. In the liver, it will go in whether there's an insulin molecule or not. On the other hand, once it's in, the insulin molecule then directs that glucose to specific forms of energy metabolism. So it is the interplay between the glucose and the insulin that ultimately determines whether a cell is going to burn that energy all the way to ATP, adenosine triphosphate, and carbon dioxide, and power the cell and give you the energy that you need to keep going, or whether that cell is going to take that glucose and divert it into a different direction. For instance, laying down fat for storage later on. And so it is that differential between glucose burning and glucose storage that dictates metabolic health. And that information is in the glucose spike, because the quicker the spike goes down, the more is being converted to energy. The slower that glucose spike is going down, the more is being converted to storage. You care because you want your mitochondria working at tip-top efficiency. You want to take all of that glucose and break it down and burn it to carbon dioxide and ATP and water, and increase your mitochondrial efficiency and increase the power of your muscles, the power of your neurons, the power of your heart, so that you can live the longest possible. That's what you want. Well, in order to do that, you need an efficient glucose rise and a rapid glucose clearance. That's what you learn from continuous glucose monitoring. And today, that is the safest and best and most expeditious way of learning that information.